It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, I'm Sam Lesante, and folks, we have a great show for you today. I'm here at the General Hospital in Hazleton. I'm at the Endo department, which is right off the main lobby, talking to great doctors, two great doctors. Most of you know these doctors, but for those who are new in the area, you're in for a good education of the kind of quality doctors we have and the latest technology we have in the Greater Hazleton area with the Greater Hazleton Health Alliance. My guest today, in certainly no order of importance, Dr. Robert Yamulla and Dr. Ed Polashenski. And first of all, doctors, thanks for coming on the show.
Thank you for having us, Sam.
Thanks for coming.
First of all, this is a great show for me, and I'll tell you why. Because you're talking to probably the biggest baby walking the face of the earth. And I'm in a place here, folks, where I'll be here in about a few weeks going through the procedures that we're talking about today. I guess it's a procedure, right?
It's a procedure.
Okay. Yes. All right. So it's we're talking about colorectal cancer, folks. It's we could kid about it to a degree, but it's a serious matter. There's about 180,000 people a year that die from this. Now, here's the interesting thing. You don't really that doesn't have to be that high if we just listen to some of the things that the doctors have to talk about today. It's a simple procedure, and I think we'll do a walkthrough of what happens. But before we do that, I said to you before when I opened the show, most of you do know Dr. Yamulla and Dr. Polashenski. I just talked to Ed here. He said he's been practicing for 29 years. I said, well, he's only a beginner.
Yeah, that's right. I'm still practicing.
Still practicing. And Bob, how long have you been around?
Well, I've been here since '87, so 20-some, 25.
And they look so young. I'm telling you, they're a lot older than me. Okay, let me ask you this. I'll start with Dr. Yamulla. Doctor, a little bit about yourself, so the people know who you are.
I was born and raised in Hazleton. I grew up on Acacia Street. I graduated from the Hazleton High School. That was the Castle on the Hill. I went to Syracuse University and Hahnemann University, and I did my residency and fellowship in the Guthrie Clinic in Sayre, Pennsylvania, and I've been practicing ever since in '87.
Now, being here in the endo department, okay, the experience, we'll talk a little bit again about, the procedures and all that stuff. Every time someone's going to a doctor, the first thing they're concerned about is, are they the best? We want to make sure we're going to quality doctors. And I've been talking for years, from day one when I started the show in 1994, we have great doctors in this area. And I'm not just saying it because I'm here. I've been advocating this for many years, folks. No reason at all to go out of town, and we're finding it out now. Your experience, how long have you been in the endo department, working in the endo department?
Well, let's see. They say about greater than 25 years.
25 years. Dr. Polashenski, hear a lot of great things about you.
Well, thank you very much.
A lot of your patients tell me how great you are, your bedside manners. A little bit about yourself.
Well, like Bob, I'm a local boy, born and raised in Hazleton. But matter of fact, Bob and I were just a couple years apart in school, so we knew each other almost our whole life. Yeah. We both went to Syracuse University and then on to medical school. And I came back to Hazleton first and started practicing here. It's my hometown. I love it. I love the people. And been here 29 years. No regrets whatsoever. Best place in the world. I could practice anywhere. Hazleton's the place for me. Wow. Bob came and joined me a couple of years after I started, and we've been together ever since, and we've been a great partnership. And
you guys are really doing a fabulous job, and I mean that sincerely. Now, I said before, Bob will be probably doing the procedure on me in a few weeks. Oh man. I don't know why I should be nervous, but let's talk about colorectal cancer. Okay, first of all, I just said 180,000 people each year die. Okay, let's talk about some of the things that we should be aware of and why we should come for the procedure.
Yes. Well, what we're trying to emphasize is screening for this disease. If we look for it ahead of time, find the problem early, it's completely treatable. The cause of the cancer are polyps. They're growths in the intestine that start out as a benign lesion. As they get bigger and bigger and bigger, become a cancerous lesion. When we screen people, 1 out of every 4 people, on average, we're finding polyps in. That's people who have no symptoms whatsoever. They come in at age 50 and we check them. 1 out of every 4 have polyps. Now, we can't say that all of those people are going to get cancer, but a very significant number of them would. So that's the idea here, is to find those polyps early and to remove them and to monitor those people that reform polyps.
Okay, so what are the symptoms, first of all, and then who should come for the procedure?
Okay. That's the scary thing. There can be no symptoms whatsoever. Okay. In the later stages, you can get abdominal pain, you can get rectal bleeding, but early on, there's no symptoms at all. It's completely asymptomatic disease, and it's only by doing the test that we find the polyps.
Now, when you're doing this test, you said about screening. Okay, what would be the first step? And first of all, who would be the person that, what age group should really be concerned about this?
We encourage anyone over the age of 50 to consider a screening colonoscopy. Now, if there's a family history, first-degree relative, we'll back that up a little bit. We'll say 45 years of age that we would like to start looking at these people. The process is fairly simple. You have to take a prep the night before. You'll have to drink some laxative to clean the intestines so that we can see. You'll come here to the hospital. You don't have to register. You can walk right back here to this department. We'll be ready for you and take you through the procedure. You're sedated. You're asleep for the procedure. You're completely comfortable. Takes about 15 minutes to do the examination.
And folks, when I was talking on the show, if remember when Dr. Yamulla was on, I waited like 3-4 years before I had the endoscopy. And, I was a nervous wreck. Still I'm a nervous wreck. But the point is, when I had it done, it was like a piece of cake, Bob. You came in, it was like a piece of cake, and I said nothing to it, and you're relieved. So as the doctor said, Polashenski said, we may have no symptoms whatsoever, okay? But sometimes, what would be your advice to someone? I see we have a list here, for example, anyone older than 60, African American of Eastern European descent, if you're eating a high diet of red processed meats, okay? If you have cancer anywhere else in your body, okay? So these are some of the things, especially if you have a family history of colon cancer, correct? Okay.
So family history is a big one. Always be aware of your family history for your doctor, all diseases.
Give me a walkthrough. What do I do?
You're going to come into our department, and you'll be greeted by one of our staff. We have wonderful experienced staff. Most of our people have been here for 15 years or more. We've had people who have been here as long as us. So I think you'll find people that are very accommodating and will be very helpful and make you feel at ease. You're going to come, they will check you in, you'll be interviewed. You've been interviewed by us already before we came in, why we're doing it and what we're looking for. You'll be interviewed by the anesthesiologist or any problems that he may encounter with giving you medicines to make you sleepy, and about your heart and your past history, smoking, things like that. They'll put an IV in your hand for the sedation.
Doesn't hurt. Doesn't hurt.
Of course, Bart, and the IV in your hand, and we bring into the room. We tend to talk, because most of the times we like to go over what it is why we're doing this, and just briefly assess for what we're looking for. After that, the anesthesiologist will give you sedation. We'll do our procedure. As he said, it takes 15-20 minutes, depending on what we find. It may take a little longer if we find some polyps to take out. After the test, you come right back here or our recovery room across. Usually with our new state-of-the-art medicines, when you first had yours done, that was back the old Diprivan Demerol days, the old Versed Demerol days rather. It took about an hour to recover. Now you're recovering about 10-15 minutes, a whole lot safer. Plus the anesthesiologist watches your vital signs while you're having the procedure. After the test, we bring your family back. We go over what we found and discuss it. Do you have any questions, any plans we found? We were going to take care of something. Not just in colonoscopies. If we have an ulcer, we're going to treat that. What are we going to do? And then we just give you something and we send you home. I'm talking as a patient because I just had mine in August, so I'm speaking as a patient as well as a doctor.
Okay. Now, when we're looking at, I said we're here at the endo department, folks, at Hazleton Hospital, which is right off the main lobby. You just come right into the place, and we put the phone number up on the screen, folks, to give a call to ask questions. And I know, let me tell you, folks, you're looking at the biggest baby. I'm telling you, I love women because they're the strongest people in the world. It's amazing. Men are babies.
That's the truth.
Women go through so much. watch. It's amazing. I would not want to be a woman today. I mean, they just go, and I admire them. But now, as we talk about this department, okay, Hazleton, as I said, the Alliance has done so many great things, and they're making major millions of dollars in investments in the community. This technology here, let's talk about the technology you have here.
Okay.
Dr. Yamulla alluded to some of the anesthesia, but some of the technology you have here.
Well, if you notice, at every bed we have state-of-the-art monitoring equipment for your blood pressure, your pulse, cardiac rhythm, oxygen levels. We have supplemental oxygen at each station, so that when the patient first comes, they're put on a monitor and all of their vital signs are monitored. Our endoscopy equipment is state-of-the-art Olympus equipment. The procedures for cleaning the instruments, the washing technology has all been just redone. The state-of-the-art washing equipment so that the scopes are completely sterilized and cleaned between each case. We have a wonderful anesthesia department here who also has great monitoring for while you're asleep in the room.
Now, are you completely asleep, or are you in twilight time?
This is a twilight sleep. If I ask you to raise your hand, you'll raise your hand.
Yeah.
You will remember nothing about it, though.
Okay.
Yes.
So, in other words, we could respond, but no one would understand.
That's correct.
Now, does the procedure hurt? Does it hurt?
Almost all the patients will have no recollection of the procedure at all. Okay? They will talk to me in the room right before we start, and I'll say, okay, we're going to get started now. They will literally think they blinked their eyes.
Yes.
And they will be back out here, and my face will be in front of them again, and I'll be talking to them. How are you feeling? The test is over. They're starting to wake up, and that will be their experience with the procedure.
You know, Doctor, I talk about many of us, feel that, we have to do these things, to prevent them. My wife's a stickler with that. Preventative medicine is so important. Make sure you go to the doctors, get your physicals, do what you have to do, your blood work and all that stuff. When it comes to stuff like this, people are very apprehensive. They're nervous, they're scared, they don't know what you're going to find. They may have some things going on with their stomach or whatever, and they're apprehensive. What do you say to people like that?
Said, you want to fix it, you have to find out what it is. And earlier find things, the easier is to treat it. Most of these things are time-based. The sooner you find out about something, the easier is to treat it. It's really true. An ounce of prevention is better than a pound of cure. If you find a little polyp, no big deal. You're out here in 15 and it's fixed. You sit on it for 10 years and it becomes something bad, and now it's spread. Now you've got a problem. So to me, it's better to go early and fight it. It's no worse if you know what it is. And most of the times when you find things early, you're better off. Almost all the time. So why not?
The statistic we mentioned, about 180,000 people a year dying of colorectal cancer, that was much higher years ago, wasn't it?
Oh, yes. Screening has really tremendously improved your chances with colorectal cancer, because we're finding these lesions earlier and earlier. We're removing these polyps. As I said, 1 in 4 people that we find polyps in. Those were people who were going to have problems. And so we're hopefully really reducing the amount of colon cancer by doing this screening test.
When you say screening, let's say, what do you mean screening?
It means a person with no symptoms or minimal symptoms who just comes in, and we're looking for these polyps.
Okay.
Yes.
And so you have to still go to
the government says you at age 50 you're entitled. I love that term.
Oh, yeah.
You're entitled to a colonoscopy. And it used to be that almost you'd have to come up with things. Insurance companies, if you found nothing. I once had a very prominent person in town who went screened and said it was a normal colon. He got a bill for $1,500. And we had to come up with something. Now the government average risk screening, increased risk screening. If you find nothing, most insurances will pay for it. So you don't end up with because a huge expense will stop people too, not just the fear. And most insurance companies, just as a screen, will do it.
So the PrEP. Everyone talks about the PrEP. Now, many years ago, my wife told me what to do, eat and stuff like that. Okay, is it? Tell me about the PrEP.
Okay. Well, there are multiple forms of the PrEP. The ones Bob and I like to use is about a gallon of liquid to drink. And
Now, it has to be Scotch. Could it be, you know,
has to be a clear liquid.
Got to see through it. You got to see through it, Jim. Yep. As long as you can see through
Oh,
it.
there goes the Scotch deal.
And you don't drive with that. That's what you're referring to.
All right, so
We usually start in the late afternoon the day before, and we start by giving the person 2 small tablets of a laxative, and then they'll start to drink this liquid preparation. And as I try to tell the people, all it is a wash. You're going to drink this, and it's going to come out the other end. And all it's doing is washing the intestines so that we can see when we go in with the colonoscope. Usually about an hour to 2 hours after you start drinking this, you'll start to move your bowels. It will become liquid, and by 9, 10 o'clock, you should be done. The prep should be finished. You may wake up during the night once or in the morning once and have a bowel movement. You show up for the test the next morning, and we're ready to go.
And let me tell you, this is, I think I had mine maybe 7 years ago or something like that, 7 or 8 years ago, I'm not sure. But I didn't really, I kid him, I didn't really mind it because I just watched my diet a little bit a couple of days before, and I really didn't mind it. It wasn't, you know, as some people say.
The prep is the most critical. You know, I really enforce doing it right, because a study came out last year where we were very, very accurate. So we find 90% of our lesions. We do on the left, but we're having problems on the right. In great centers, we're missing like 30% of polyps, and one of the problems was the prep. The better your prep, the better you look. Little tiny polyp, sometimes a little flat polyp this big can be a lot of trouble. So that prep not only is, it's real important. It's probably the most important part of the exam is doing that prep right.
All right, now folks, I'm here with Dr. Yamulla and Dr. Polashenski in Endo Department. You know, we have to talk about these things, and you know, as they're talking, I know how I feel, or I felt, coming up, but the point is, it has to be done. You know, if you're over 50 years old, you really want to get a screening, you know, address it, you know, and that's what we all have to do is address it. And you know, some people are a little embarrassed. You know, you're dealing with human beings,
yes,
you know,
absolutely.
and you know, so take me through that fact that, you know, they should not feel that way, you know, when they're coming in. They should not feel embarrassed. You know, it's just, you know, it's their body, and some people are, you know, a little touchy about things like that.
This is done in complete privacy. We try and keep our HIPAA rules. Some of those rules are real good rules because, yeah, it's no fun. You don't want to see your next door neighbor here or somebody you know here. You want some privacy, and we try to take some steps to make sure that this is done quickly. When, for example, your bottom's exposed, you're pretty sleepy. You don't even remember that it's being done. And as soon as we're done, you're covered up and you're off by yourself. You see all the curtains, or we also have a recovery room over here where there's plenty of privacy to recover. And you know, it's like when you go to the bathroom. You don't like going to the bathroom either, but you have privacy, and that's the reason bathrooms are designed the way they are, and that's the way this place is designed the way it is.
The place is so comfortable, first of all. You feel like you're in your own, it's a very comfortable, it's not like walking into, like, you know, a static place. It's very warm.
Yes.
It's inviting, and you have great people here.
Wonderful staff. We have a wonderful staff here.
I think maybe that's a very important part of this too. We treat everybody like family here. Our nurses will protect you, will talk to you, will comfort you, will make sure that your privacy is taken care of. Bob and I, we've both had the procedure. We know what it's like to go through this as a patient. So it's a matter of just being kind and considerate to the person that you're dealing with and treating. And that's why we're here.
Okay, Bob, let's, for the sake of people who are going through the channels, folks, I'm up here at the Hazleton General Hospital. I'm in the Endo Department, which is when you come in the lobby, just walk straight. It's off to your right. It's very private. And we're talking about colorectal cancer. There's 180,000 people die a year of this, and I'm not going to say that everyone should not die from it, but if a majority of them did have screening, I'm sure many of them would have been saved. Okay, now, just to review, as I did with Dr. Polashenski, Dr. Yamulla, some of the symptoms again, or reasons, what age, and just to review that.
Number one, don't rely on symptoms.
Okay.
You want to be, when these things are treatable, there are usually no symptoms. I mean, if you, by that being said, yes, you have bleeding, you have a change of bowel. Change of bowel means more diarrhea, more constipation, you have crampy pain, you're losing weight for some reason. Those are certainly reasons to look. That's not screening, that's looking for a problem. Family history, real important. Everybody in your family, or lots of folks in your family, especially first-degree relatives, parents, brothers, sisters, have colon cancer, move everything 10 years sooner. So if you're entitled to one at age 50, if you have in your family, you're entitled at age 40. You have a thing called inflammatory bowel disease. Your doctor is going to harangue you to be watching that, because those folks have a greater risk of colorectal cancer. And you talk about some of the preventative things as far as, with your diet. Unfortunately, our society it's two people working, so everybody has their red meat because it's easier to make things, because nobody has time to make all their well-balanced meals like Mom used to make 40 years ago.
Oh, yeah.
But hey, listen, give up, a good trick, give up meat two nights out of the week and use vegetarian things. It'll lower your risk a little bit. So, but what is, as far as other reasons, I'm trying to think of anything else. So,
the best reason is just routine. Make sure.
The best reason is routine.
Routine. Just make sure it's routine. Now, okay. Now here we go. We got the good news and bad news. Okay, and so the good news is you come up here, you get your procedure done. You and Dr. Yamulla come out and say, hey, everything was good, everything looks good. And if it's good news, you're relieved. The bad news is you find something. Okay, now what do you do?
Okay, well, what the good news is, you're done for 10 years. We'll tell you we'll see you again in 10 years for your next screening. If we find something, if we find a polyp, almost always, more than 90% of the time, we can remove that right at the time of the procedure. It extends the procedure maybe another 5 or 10 minutes to take that polyp out. We will then take it to the laboratory. We will examine it under the microscope. We will determine what kind of polyp and if there's any cancer cells in it. If it's a benign polyp, then we're going to tell you, well, you've had polyps. We want to see you back in 2 or 3 years just to recheck. Since we found polyps in you, we feel you're at an increased risk. So in 2 or 3 years, we'll call you back and we'll recheck again. If no polyps are found at the second test, then you're good for 10 years again.
Now, they have procedures, of course, that if you should find a polyp that is cancerous, okay, the end of the world does not come, okay, of course you're concerned. What are some of the things that then happen if you do find, a cancerous polyp?
Well, let me back up a little bit, because polyps come in different grades. It's not, either benign or cancerous.
Okay.
Polyps can be very, very friendly, meaning they're very, very benign and unlikely to harm you, to quite sinister. We got a thing called dysplasia, which is not cancer, but you leave it there long as it's going to become cancer. So depending on whether or not, if it's up to that point of dysplasia, a lot of times removing it cures it. You're done. I mean, we'll go back to make sure it's gone and make sure you don't get any more, but you're done. Now, let's say there is cancer in that polyp. Well, sometimes even then, the colonoscopy is enough. If there's enough, the pathologist will look at that specimen. We have an excellent pathology department. They'll look at that specimen. If the cancer is so far from where you snared, maybe done again. You're done. You don't even need an operation. You're done, and it's fixed. Well, yeah, we'll go back and make sure there's nothing left or there's more. Now, what if that's not the case? That's the time to find the cancers, because cancers won't kill you if they don't get out of the colon. Cancers start in one place. They sort of are very, very predictable. And then they march out of the colon, they get into what are called the lymph nodes and into the liver. And the farther it gets, the more trouble you have. But it's there, and if it's in that polyp and it's nowhere else, it's not through the lining, it's not through all the layers of the colon, it's not in those lymph nodes. If the surgeon most of the time can resect that, put things back together, it'll work. Yeah, it's an operation, but it'll work as good as new. Most people worry about colostomy bags. That only happens usually if it's the very bottom, the rectum. 99% of the time, as long as you're that far from the bottom, you don't need a colostomy. Everybody's afraid of me. But doctor, I'm going to have a colostomy with my operation. It's very rarely, except for the rectal ones. Most times that never ever happens. So you resect it and you fix it, and it'll work as good as new. You'll need about 1/3, 1/4 your colon to work. You don't need all of it. It'll work the same.
And talking about, the anesthesia and the latest state of art of equipment they have here, just review again as people are going through the channels. And we're here at the Hazleton General Hospital, folks, in the endo department, talking about the latest in technology. So starting from the anesthesia to any equipment or anything that makes it a little bit better for us.
Well, Like I said, we have the state-of-the-art endoscopy equipment, cleaning equipment, monitoring systems. Our anesthesia department is excellent. Our pathology department is excellent as far as looking at the specimens we remove. So I think you can be assured that when you come to the Greater Hazleton Health Alliance and to the hospital, you'll be getting first-class treatment, and you can be assured that we have a very kind and compassionate staff who's going to take care of you. And I think we will make this as pleasant an experience as can be for a medical test.
Folks, Dr. Polashenski and Dr. Yamulla here at the Endo department. I know I'm coming up for my procedure. Hopefully it's routine, but again, you're looking at the biggest baby on television. So if I'm coming up here, you know, you certainly should do that. And I guess the rule of thumb is if you're 50 or older, you should really make it an appointment, okay? And the phone numbers are, or just call for advice, you know. I usually talk to Bob here on some concerns I have, or Dr. Polashenski, you know, just call for advice and ask him some questions if you have, so they could walk you through it. Here again, it's like anything else, you know, when you come for either blood work or whatever test, you know, they tell you go to your doctor at least once a year to get an examination, you know, because you guys see things that we don't really. The number of doctors I have on the show, when you're talking about when they feel your stomach, they're feeling for something. You don't know why they do your ankles, etc. But there's reasons for that. Okay, staying here in Hazleton and having two great guys like you, it's really you know, you have a little experience, 30 years. You know, I think they know what they're doing. The staff here is fabulous, folks, but they really are. I'm not just saying that, but I was asked, you know, before I was someplace and someone said to me, Sammy, can I ask you a question? Yeah, because they tell me the truth. Now, I know you're on television. I know you have to say these things and about the doctors and etc. And really, you know, are the doctors really that good in this area? Do I have to go to Philadelphia? And I told him, and I'm as true as I'm standing here, I said, I've been around a long time, even though I'm 40 years old. That's a lie. I said, when I tell you folks that we have great doctors in the area, people who've come here, and I've interviewed on my show, we are very fortunate not only to have the doctors and the people who are working here, but the amount of money that the Alliance has invested in this community. Yes. You know, and all the state of the arts. I mean, believe me, it's you know, you really, unless it's a serious heart operation or something, your brain, etc. You know,
if we need to refer to a tertiary center, we're going to tell you. We're going to be honest with you.
Yes, absolutely.
So you had the procedure.
Yes, I did.
You had the procedure.
It's in August this year.
Okay, and you better be good with me, okay? Because I'm coming up. You better be kind.
Yes, sir.
Because I'll be shaking like this. Okay. Anything in closing you'd like to tell our audience, Doctor?
If you have any questions about this procedure or any procedure that we do in gastroenterology, call our office. We'll be more than happy to see you, to meet with you, to discuss any concerns you have, and also talk with your family doctors. We have fantastic family physicians in this community who understand these procedures. Many of them have been our patients, and they also will help you to make a decision what's right and best for you.
Doctor?
And if I can brag about one thing, is our hospital staff, as far as experience, worry about safety, patient safety, and kindness. You're not going to beat us. You're not going to beat our staff.
And another thing, folks, they're not strangers. They live here, they have family here, they shop here, so you're going to see them, okay? You're not going to, no strangers coming in and saying bye-bye after they leave. We're here at the General Hospital at the Endo Department. Phone number's on the screen, folks. I'm coming up. I have to get the procedure done. I do it as routine. I'm a nervous wreck, but it works. These guys are fabulous. You have any questions, please give them a call, and let's not be a statistic like 180,000 each year. Let's not be a statistics. I'm Sam Lesante. We'll see you next time.